Hi, everyone. This is our great pleasure to invite Professor Chung Pak-Kwong as the guest in our ASPA COVID-19 series interviews. Professor Chung is currently the chairman of Physical Fitness Association of Hong Kong. He's also the Associate Dean in the Faculty of Social Sciences at Hong Kong Baptist University. He's also the professor at the Department of Sport and Physical Education at Hong Kong Baptist University. Welcome, Professor Chung.
Hi, how are you, Dr. Duan?
I'm fine, thank you. It's our great pleasure to have you here. Yeah. So may I firstly invite you to tell us a little bit about yourself. For example, where did you receive your academic training and what are your research interests?
Well, actually, my education background quite diversified. Actually, I was born in Hong Kong and I completed my primary and secondary school in Hong Kong, and then I went to Taiwan, okay, to study physical education in Taiwan Normal University. Then, I came back to Hong Kong to become a secondary school PE teacher, and I taught for 2 years. And then I got an opportunity to join the tertiary education. I joined PolyU and spent there for a year as a PE instructor. And then, I went to Hong Kong U and then spent 6 years in Hong Kong U and to be a PE instructor and also officer. Other than teaching, I also, responsible for the facility management. Then, I took a full year to United States and study in Springfield College in Massachusetts. And I got my master's degree in United States. Then returned to Hong Kong and I joined Hong Kong Baptist University in the late 80s. And actually at that time, because in Hong Kong, we don't have any full-time degree in PE or PE related program. So at that time, I joined HKBU and started to work to develop a program. Just like now, currently we have a program called Physical Education and Recreation Management. That's our first ever full-time program in Hong Kong tertiary education. Then, I become the first course leader at that time. And then when we finished the development and get the program supported by the government, and then I went back to Springfield College and then to started my PhD program in the United States. After that, I returned to Hong Kong and worked in Hong Kong Baptist University for another few years. Then I joined the Hong Kong Sports Institute. It's the institute supported by the government to train all the Hong Kong top elite athletes. Very similar to the training institute in Canberra. Okay, the Australian Institute in Canberra. Okay, very similar. And then I spent almost 10 years in the institute to be the executive. Okay, to oversee all the head coaches and all the training programs in the Hong Kong Sports Institute. Then, after almost 10 years there, and then I returned to Hong Kong BU and become the department head, okay? And totally I served as a head for 9 years. And recently, I just, probably retired from being a head, and then I took up a new appointment as the Associate Dean for the Faculty of Social Sciences. That's what I have the background. Okay, thank you.
Thank you. What are your research interests?
Well, my research interests probably broadly speaking is talk about the health, relate to health, anything PA, physical activities, and also exercise and sports. But in recent 5 years, I am more focused on elderly. Okay, because Hong Kong become one of the cities we call that the aging society, and therefore I see that that's important, and I start working on in this population. So recently I got a grant mainly on on those research including the recent grants talk about how exercise can improve older people's resilience. Okay, in that research, we try to use resistance training, okay, and compare with Tai Chi, and see which exercise will be, will have a more effectiveness for improving older people's resilience. So recently I joined another project, and other than aging elderly people, and also one more important for those youngsters, especially kindergarteners, okay, the student in studying in kindergarten. So I joined the project supported by Hong Kong Jockey Club, okay, to support the project, try to identify the physical fitness level, and also the exercise program to improve the overall fitness of the kindergarteners. So that's another program.
Thank you so much. Very impressive education and working experience, both in academia and the practical setting related to sports sciences. Thank you. And I know you are currently the chairman of Physical Fitness Association of Hong Kong. As far as I know, this association is a well-known and a professional organization in Hong Kong related to the development of people's physical fitness. So please briefly introduce us this association. Thank you.
Yeah, actually, we formed this association in 1986, okay, how many years ago? Actually, long years ago. And we found at the time, Hong Kong people tend to have, they didn't have knowledge about physical fitness at that time. Even we tried to translate to Chinese, physical fitness. At that time, then we become a group of pioneers to promote physical fitness in Hong Kong. So that's why we form the association, so that the association can really can get a group of people from different universities join together, and then we have our terms and reference, and also and try to raise funding from the government and other stakeholders to support the association. So the association mainly to promote physical fitness in Hong Kong, in all age group, okay, including youngster and adults and older adults, okay. And recently, probably because of COVID-19, actually, we work together with the government and also the Hong Kong Jockey Club, and try to promote home exercise. And we videotape, almost more than probably 20 to 30 video clips, and so that through online we can teach the youngster and even the elderly people how to do exercise at home, because now we're being locked up, and everybody, even Hong Kong recent situation is getting worse, okay, starting from tomorrow, probably you are aware that starting from tomorrow, and the government warned that, okay, if you go out, only allow 2 people in a group, okay, two person in a group. So, and also we the government try to limit those crowded area, including ask people to wear masks, even in both inside or outdoor, okay. Yes. So that's why I see it's more important. We have to continue our exercise or workout habit, and if not going out, how about at home? So that's why recent months we try to promote this concept and continue our exercise at home.
Okay, that's very meaningful, especially during this special period of COVID-19 outbreak. So we know there is a huge body of evidence showing the health benefits of maintaining regular physical activity. However, as you mentioned before, under the special circumstances, how can we as the sports scientists to motivate people maintain their physical activity at home or outdoor? I know you are the expert in the field of physical fitness and sports psychology. So do you have any advices to the public about how to maintain physical activity during this COVID-19 outbreak?
Actually, honestly speaking, I think it's very difficult, okay, because Hong Kong situation is a little bit different from the situation in Australia, the United States, or even the UK, because their living space is very small, okay. Most of people they living in an apartment, okay. The apartment only a small space, and whole family have to stay at home, and so that's why allow them to exercise. Actually, the space is very limited. And we can only afford to do some calisthenics, okay, body weight exercise, and not using too much space, okay. So that's the idea when we design the program, and also heavily rely on parents. I mean, talk about the children, okay, children, because they don't have the schooling, okay, they don't go to school, and they don't have any extracurricular activities. However, most of the household in Hong Kong, the family, okay, both parents, they're working. If they're working outside, yes, if not, even they're working at home, okay, and they try to let the children not disturbing their home, office, okay, working. So that's why the space is a limitation, and also the time also another limitation, so that the parents can really work together, or to really to motivate their kids or their children to continue the exercise. It's very difficult.
Yes.
Having said that, we still have to really try to promote, okay, this kind of the concept, and saying that for children, okay, the WHO recommending at least 60 minutes per day. I don't see it, not that many. Children actually can really achieve that recommendation.
Yeah.
Having said that, we have to really still have to try to promote among the parents. If not 60 minutes, how about 30 minutes or 15 minutes per day, okay? We have to really carry on that kind of message, very strong message, and try to encourage the parents, okay? After the work, when they get back from work to home, and then spend probably at least half an hour so that they can really do exercise with their kids at home. Or they can rely on their teachers, okay? I know that some of the schools, they still have online PE lessons through the online, okay? So that the teacher can really teach the children to continue their PE lessons, doing home exercise. So I think it's very difficult to convince everybody can do that, but we have to try very hard. So our association, that's why our association to prepare those clips, okay, video clips, so that every time you can click on the link, you can just follow the instruction, and then anytime, no time restriction, just follow the instructor to do exercise.
Oh, this is very helpful, especially for this young children and adolescents. They are quite more likely access this mobile phone, and with this video instructor, I hope this is a good way to motivate them to do more physical activity at home. Yes.
Yeah, the parents, I think it's more important. The parents have to be role model, okay, role model, and they have to really do exercise, okay, or lead them to do exercise. Otherwise, you can see that most of the children, okay, staying home, the screen time increase. Even some of the students, actually, they are not really when they're doing online, means even through online teaching, most of them, they are not really paying focus, okay? I heard that some of them, okay, they play their own games when they're doing online, okay, teaching or learning. But if their parents, okay, have to really try to give them some instruction, and try to encourage them, give them some incentive, okay, to do exercise. I think that the parents' role is getting more and more important when they're staying home.
Yeah, fantastic. We just talked about the children's physical activity. So how about old adults? As we know, currently under the COVID-19 outbreak, old adults are at the higher population, a higher risk of population and this virus situation. So how can we motivate more old adults to engage in more physical activity? Do you have some advices to us?
I think, depending on, the for those older adults, they're living at home with their children, and maybe easier, okay, maybe easier. for those living in the nursing home, okay, those elderly center, and depending on, because recently, okay, some of the outbreak, COVID-19 outbreak happened, okay, in elderly centers. So that's why they tighten up, I mean, the monitoring, and also they don't allow visitors, even their their kids want to, okay, pay visit to those elderly people, they don't allow them to visit, okay? Yeah. So other than lacking of physical activity, also they are affecting their emotion, the mental part, okay? So some of the center, they allow, the elderly to communicate with the, with their kids, okay? Through mobile phone, okay? Online, through, through online, through, for example, WhatsApp, WeChat, those mobile phone, the video, online communication is getting more important between, the older people with their family members. And some of the older people, they have their grandson, granddaughter, and those important too, if they can really say a few words, do some communication with the older people when they staying in the elderly center, will be much better, to ease their stress. Yeah. And for the elderly center, I noticed that some of the center, they still have regular physical activity lesson, okay, being supervised by the members, by the by those staff. And for the general public, because the lockdown will really discourage the older people to go out. Yes. So if they long time stay at home, will be much difficult for them to get exercise. So that's a problem actually now we are facing.
Yes. So you mentioned a very important factors which influence old adults' physical activity is social support. It's better they have the support from families, friends, or even caregiver, which is will have a good or positive influence on them, right? Also with the guidance of how to do physical activity. This is also important for old adults because some of them maybe they lack of knowledge about doing physical activity.
Yeah, most of the older adults don't have knowledge, and if no COVID-19, okay, the normal situation, most of the older people, okay, when they wake up and they tend to go out, okay, to have some breakfast in the Chinese restaurant. Then they will go to park, okay, walk in the park. But recently, they are being locked up and at home, and so that's why they can't take a walk outside, okay. If staying at home, they can do some, stretching. If they have the habit, okay, such habit, they will do some stretching. But really, very limited, okay, because usually walking is very good for older people. But at home, the space can allow them to walk. At home, they can do stepping. Okay, they can be taught by doing some stepping, doing stretching, and doing some body weight exercise. But need some support. Okay, from the family members, and also the older adult, they tend to not get used to use online kind of video. They don't follow video to do exercise. Not like the youngsters. Okay, very easy to use online to do exercise. But for the older people in Hong Kong, they're not get used to using the online kind of channel, so that they can follow the instructor to do exercise. Okay, so extra support must be given by the family members.
Very useful advices for the population at different ages. Okay, I have my last two questions. Based on my observation, I'm seeing more and more people, they engage in jogging outdoors wearing face mask.
Yeah.
And this is very special phenomena at this period of time. So as a sports scientist, do you have any comments about this kind of behavior? Do you think there is some harmful side effect when people engage in a certain intensity of physical activity, but meanwhile wearing the face mask? So what's your comments on this phenomena?
Well, actually, starting from tomorrow, everybody, when they go out, even you are doing workout, okay, you have to wear, we call it surgical mask, okay, surgical mask. Because mask, we have a sport mask, okay, try to limit your breathing so that you can train harder, okay. But surgical mask, definitely try to prevent those virus, okay, coming in. So when you wear mask, okay, if the exercise intensity is not too high, it's moderate, I think it's still acceptable. But however, taking into consideration the reason, Hong Kong, now is summertime, it's very hot outside,
Yes.
talk about 34 something degrees Celsius, okay, every day, and humid. And when you wearing a mask, surgical mask, and do some running, if the intensity is too high, and then will cause you, lack of breathing, okay, lack of air, breathing will be more difficult. For those less fit people, okay, prone to cause some, risk on the heart, okay, on the heart, even breathing, okay. Well, the circulation must be a lot, the ideal, wearing mask, okay. So that's why depending the intensity and also the fitness level, and for athlete, probably they running in certain, level, they still can sustain, those kind of, breathing limitation. But for general public, I think they shouldn't be doing too high level of, exercise when they're wearing mask.
Okay.
Walking is okay. Walking is okay.
Okay. Thank you so much, Professor Chung.
Okay,
You
you're welcome.
provide us many scientific suggestions and advices about how to maintain physical activity and the COVID-19 outbreak, specifically for the population at young ages and old-aged people, and also share your observation, your comments about people who engage in physical activity wearing face mask, what they should be aware of something to have safe physical activity. Thank you so much for your time.
I hope everybody can keep safe, okay, and also keep, exercise and use exercise to strengthen your body and mind and also spirit, okay?
Thank you so much. Also, please keep safe and healthy. Thank
Thank
you.
you.
Bye-bye.
Bye.
Bye.